So we are very, very fortunate to have with us today Dr. Amanda Fallin Bennett. Um, she's an active early career tobacco control scientist who focuses on tobacco use and disparate populations. She's a faculty associate in the Tobacco Policy Research Program. She has a program of research focused on tobacco use and substance use and has led studies funded by NCI and NIDA and foundations. And those studies are related to tobacco use, policy, and prevention for vulnerable populations in tobacco growing states and among lesbian, gay, bisexual, and transgender adults, college students, and also bar-going young adults. So Dr. Fallin Bennett also serves as the program director for Voices of Hope, a local recovery community center in Lexington, Kentucky. So we are very glad to have you here, Dr. Amanda, and we look forward to hearing from you. And with that, I'll mute and turn it over to you so you can take over.
Thank you. I'm very happy to be here with all of you today, and it's definitely the one of the joys, I guess, of the new Zoom world that I can be in my home in Kentucky and also with you all in Maryland. So this is wonderful. Nice to see all of you and some familiar faces and names. As was said, I'm going to be talking to you today about tailoring tobacco treatment and policy for the LGBTQ community. So just to give you a brief overview of kind of where we're going to be going during this talk, I'll start by identifying the link between tobacco industry targeting and LGBTQ tobacco use disparities. I will discuss subgroup differences in tobacco use characteristics, so age of first use, cigarettes per day, things like that. We will discuss evidence-based tobacco treatment programs and smoke and tobacco-free policy in specific LGBTQ areas. And everyone working in the field of tobacco control probably knows that we're now past the 50-year anniversary of the Surgeon General's report on the health consequences of smoking. And so the reason that I start with this when I talk about smoking in disparate populations is just to remind us, where we came from and then, what the landscape looks like now. And so at the time that the Surgeon General's report was drafted, 1 in every 2 men was used tobacco products, and also 1 in every 3 women. And so at the time of the Surgeon General's report coming out, smoking was basically ubiquitous. It was everywhere. And so of course we've had these very dramatic reductions in smoking since that time, though 20 million more people have died since the release of this report. Again, just to take some of you back, or to take us back, I know we all know, quite how, prevalent smoking was, but, again, just as a reminder, we, many years ago, prior to the Surgeon General's report, would have doctors, nurses, dentists, promoting tobacco products, which ones are the best for you, the least irritating. And smoking was everywhere, really everywhere. And so in my lifetime, you could smoke on a plane, for example. And when the very first smoking restrictions came on airplanes, you couldn't smoke on flights that were less than 2 hours. Or yes, less than 2 hours, because it was still considered that more than 2 hours, people might not be able to make it through that. And that was a controversial policy at that time. And so, of course, we know now, we're in a completely different world where we've gone through, I'm sorry, smoke-free bar and restaurant policies. And, now we're talking about, tobacco-free, of course, entire hospital campuses, college campuses, cities, in some locations, in LGBTQ pride festivals. We can talk about tobacco-free. But the reason that I like to remind us that smoking used to be everywhere is because to highlight how much it's a social justice issue now. So in the past, obviously public health issue, but now smoking is so concentrated among people who are at some type of disadvantage. I did my postdoctoral training at UCSF, so in San Francisco. I live in Kentucky now, and I've returned to Kentucky. But when I moved to San Francisco, and I would tell people, and this was even back in 2011, what I do, that I study tobacco use and secondhand smoke, and people would look at me and ask, does anybody still smoke? And, so of course, having moved there from Kentucky and growing up in a rural area, and still now back in rural Kentucky, nobody would ask that question here, but it certainly goes to show, how concentrated smoking is in certain disadvantaged groups. And so we know that when we talk about, so who does still smoke? Does anyone still smoke? The answer to that question is certainly yes. People with addictions, people with other behavioral health conditions, much more likely to smoke. Members of the LGBTQ community, like we're going to discuss today, much more likely to smoke. People living in rural areas, tobacco growing states, etc. So I just like to bring that up so that we can just really remember that smoking now is a social justice issue as much as it is a public health issue, and that burden really falls on these vulnerable groups. So I want to start with talking about why LGBT people smoke more than the general population, because I think before we can really talk about how to tailor treatment, it's less clinical and more focused on why the disparity is there and why it's so great in the first place. Because we do know that people who identify as LGBTQ are just as likely as anybody in the general population to say that they wish they would like to stop smoking. Far less likely to be interested in things like contacting a quit line or speaking with their provider. But so of course it's not out of a lack of interest, but maybe rather out of these other issues in their lives, and also perhaps a mistrust of our healthcare system. So we'll talk about that first, just because I think it's the most important thing that we can really do to help reduce the disparities in this population, is to understand why they're there. So there are several reasons why, but one thing is that there are smoking risk factors in the general population. So having depression and stress, alcohol use, other drug use, and experiencing trauma, victimization, we know that these factors increase the risk of smoking among the general population. And we also know that people who are LGBTQ just experience these particular risk factors on the whole more often than their heterosexual straight counterparts. So it's part of the reason. Then there are also risk factors that are specific to LGBTQ people. So experiencing negative reactions to disclosure of your sexual orientation is a risk factor for smoking, and also for alcohol and other drug use. And so this is particularly the case if this negative reaction comes from your family, your nuclear family unit. And then internalized homophobia, or feelings of guilt or shame about your sexual orientation, is another risk factor that's specific to the population that increases the risk of smoking, and again, also alcohol and other drug use, which further increase the risk of smoking. And so we know from these risk factors that there are things we can do to reduce the risk that have nothing to do ostensibly with smoking. And so we know, for example, that in middle schools and high schools where there's a GSA, so traditionally was a gay-straight alliance, some people refer to them now as a gender sexuality alliance to be more inclusive in their language, that in schools that have GSAs, which are places, of course, where students could find support from other students and usually a faculty mentor, and it also probably stands in as a proxy for the school being more LGBT friendly than others, that there is less smoking, there's less tobacco use, and there's less, other risky behaviors. So this is just one example of how really just changing the environment rather than focusing in specifically on tobacco use can be very helpful. And then we have other environmental risk factors to consider. So many of you probably know that when we celebrate the LGBTQ prides, that it's on the anniversary of what actually were riots at the Stonewall Inn. And it's significant because it helps us understand that though the world has changed a lot and that this is thankfully not the case anymore, it used to be the case that in order to meet other people who are LGBTQ or to find safe spaces for socializing or organizing, the early political organizing for gay rights happened in bars. And, definitely in the 60s and 70s, actually through the 80s, that remained really the case, that it was a primary place for socialization for LGBTQ people. It was also, they were also like very smoky environments. And so, certainly now there are other ways, but still so much then of LGBTQ community at that time, if you're gathering in bars, smoky bars, and people are smoking, it becomes a sort of a community norm that can be passed down. And still, even though of course the world is different and the landscape is different, there still certainly is more socializing in bars. And there are still LGBTQ bars. And so our team has done some research showing that people who, it was in Las Vegas, people who primarily socialized in LGBTQ bars were still at that time more likely to be exposed to secondhand smoke. So that was still existing in more recent times. And then we also know that not only are bars smoky in cities where they don't have a smoke-free law, but the consumption of alcohol is highly linked to smoking, and tobacco companies do promotions of cigarettes within the bar setting. So there's a lot of reasons that bars are places where that increase the risk of tobacco use. And then the environmental smoking risk factor that I want to focus on most for you all is to talk about the role of the tobacco companies. And so again, everyone here working in tobacco control, I'm sure it's no surprise to you that, the tobacco companies advertise cigarettes to LGBTQ people because they advertise cigarettes to everyone, right? But actually there was really a lot of thought back, even in the early 90s about being able to market to this population, which again, to sort of take you back through the decades was not now. Of course, we can turn on the TV and see, an ad for like Travelocity, and there's an LGBT, there could be a gay couple on there, and it's just part of the ad, But of course, in the 90s, that was not true, and lots of companies were not already targeting LGBTQ people at that time. So just to take it back and let you see like how orchestrated this was. So Philip Morris, a major tobacco company, way back, in 1987, began giving funding to many AIDS-related organizations, which, of course, on one hand is great because there was a lot of need, a lot of death, not a lot of major corporations, feeling the need, but of course, at the same time, not something that, you could really turn down. And so we know also that corporate donations to organizations often come with, advertising, other types of pressure. And so you can see here, like the gay men's health crisis was receiving money from Philip Morris as far back as 1987, which again, very unusual. So, and then so we all know now that and we focus on and have for, some time in the public health community, the increased rates of smoking among LGBTQ people, but that was not the case in 1997. You're not seeing a lot of conferences for, general public health practitioners to talk about, smoking in this population, and the tobacco companies definitely were on it. They definitely knew, even then that this was a target population, so to speak. And so Benson and Hedges, I'm going to use several of these. This is a document that comes from what are referred to as previously secret tobacco industry documents. They were released as a part of a legal settlement. And so there are, millions of these documents that you can search online. I did a lot of this work, back when I was a postdoc, and certainly find it fascinating to learn more about the industry behaviors, but also scary as well to realize how, planned out a lot of these things that we see today in terms of disparities, how much influence the industries really had. So again, this is Philip Morris, and this is a memo that they are receiving from Benson and Hedges, a PR firm that works with the tobacco companies. And it says, Philip Morris has led the competition in the gay and lesbian market. They have negotiated contracts. Again, this is not, typical at this time for corporations to be, even really much targeting this population. And so this is just bringing this up a little bit larger for you to see. But so why is the market, so gay and lesbian people, getting attention of the tobacco industry? So they say there's a higher incidence of smoking adults. So again, they're realizing this back in the 90s and capitalizing on it. Access to more adult venues of entertainment. Again, the bar scene. Appreciation for freedom of speech, and a large number of events across the country that invite sponsor participation. So the industry has been sponsoring LGBTQ pride events for a very long time. And so you can see here, surveys completed at gay and lesbian events. The gay and lesbian market has a higher incidence of smoking than the general population. That, coupled with the increased amount of time gay and lesbian consumers spend in all adult venues like bars, make this a great untapped market for tobacco companies. So in the early 90s, there had never been a Fortune 500 company actually advertise in gay press. And so at that time in 1992 to 93, Philip Morris purchased ads to run in genre. And this was, again, really groundbreaking. And so Philip Morris wanted it to be sort of under, kind of under the radar. It wasn't an ad that looks like an ad today that would be targeting, LGBTQ people. There were no rainbow flags. They just put one of their ads in there. Definitely weren't trying to call attention to it. And the editor of genre was so happy and excited because, again, never had a Fortune 500 company done this, that they issued a press release. And so it ran in, the paper, all, in multiple major media outlets across the country that, you can see here, overcoming a deep-rooted reluctance, more firms advertise to the gay community. And this is the New York Post saying that there are new cigarettes aimed at gay smokers. And I just like to point this out. It says, "Don't look now, Marlboro Man, but you've got a brand new gay partner." And so this, media reaction just shows really just how novel it was to just how groundbreaking it was that this was happening, but also hopefully then you can see just how predatory it is too in terms of reaching out to the population like this at that time. And now, so this is genre now. Obviously, things have kind of moved forward, but it's incredibly common now for gay press, LGBTQ press, to include tobacco product advertising, and also for the ads to be much more targeted than they were then. And I will just show you some examples of that. So back at 1995, as you can see here, this was a Parliament ad. This is an ad that they would run in, kind of in the magazine anywhere. And then this is the one that they ran in Out magazine in 1995. So again, they were trying, to make it so it didn't look like, they didn't want to be associated entirely with LGBTQ issues because of the controversy, but by adding, the small edition, the edition of the man, and running it in Out magazine, this was there at the time targeting of LGBTQ people. Now, of course, if you've seen any ads recently, things have changed a lot. So those things, I've been talking some about, what Philip Morris was doing. Similarly, RJ Reynolds was also targeting the LGBTQ community in the time. And so many of you may have heard about this now because there have been some ad, campaigns and stuff sort of exposing the tobacco companies for having done this. But in the mid 1990s, RJ Reynolds did create a plan to market tobacco products to gay and homeless men. And very seemingly very, very derogatory name, Project Scum. It stood for Subculture Urban Marketing. And what they were doing was advertising in some neighborhoods in San Francisco. So if you're familiar with San Francisco, it was in the Tenderloin, the Castro. And so that's why they were advertising to those two populations together, because at the time there was more of an overlap. But, again, of course, super derogatory name, super predatory practice that they had. This continues on in terms of, moving into the 2000s, still a lot of advertising to this population was general, like the general ads, but running in LGBTQ press. But, now, like, as I mentioned, like, as thankfully we've moved on from a lot of stigmas around the issue. But at the same time, now tobacco companies have very, very, very overt advertising for this population. So this was a 2000 ad that was running in LGBTQ press that says, "I choose." Obviously, it was focusing on what they were calling like an appreciation of choice and, living your life. And then in 2005, so if you remember, or possibly some people might be too young, but around 2004, there was a big push, nationwide. There were lots of marriage, ballots, ballot initiatives to ban gay marriage. So marriage was a really big, sort of hot topic at that time, and obviously something that, many members of the community would be very concerned about. And so this is a Natural American Spirit ad. And the ad says, "Freedom to speak, to choose, to marry, to be, to inhale, to love, to live. It's all good." So it's clearly an ad that is equating the ability to choose, your partner, to get married, to love, with the freedom to smoke. And, by around 2011, there were, even more overt, take pride in your flavor, advertising tobacco products as, part of pride in LGBTQ. So, and this is not something that the tobacco companies only did for the LGBTQ community, obviously not. They're masters at, advertising, and have been at this a long time too. And so the American Tobacco Company back in the 20s, which was before the advent of modern public relations campaigns, worked with a PR company to try to figure out why it was that, how to get more women in the United States to smoke. Because at the time, I told you at the time of the Surgeon General's report, 1 in 3 women were smoking. That was not the case, more at the earlier part of the 1900s. And so the American Tobacco Company noticed, there's this huge untapped market in women if they could get, promote, them to start smoking. And so they actually worked with a PR firm and had a campaign called Torches of Freedom, and had women march in the Macy's Day Parade, down this main street, smoking. And what they did was equate women's liberation and women's freedom with the freedom to smoke. So it's a very similar thing they're doing in the 20s. They're doing, in 2005 to recruit LGBTQ smokers. And still some of this advertising using these like freedom and rights has not stopped. And so this is a green smoke, an e-cigarette ad that came out around Martin Luther King Day on social media that just says, "I have a dream." And it's an e-cigarette ad. Another thing that the companies have done is sort of social giving to, social causes. So as I mentioned in the 80s, giving to HIV/AIDS charities. The tobacco companies were giving, like Lucky Strike was giving to GLAAD way back, 2001. Like, as you can see, this was an insert, and it says, "Whenever someone yells, 'Dude, that's so gay,' we'll be there. Thank you to GLAAD for allowing us to be a part of this important event." And so they didn't just take out ads, put them in the program inserts. They would set up smoking lounges. This is Brown and Williamson, at GLAD events and set up, again, smoking lounges, cigarettes, and, really just trying to equate like their support for LGBTQ rights with smoking. And in reality, the tobacco companies did lead the way in supporting LGBTQ rights. They were some of the first places to have non-discrimination hiring policies. But and so it's a complicated thing because it's, they were causes that were very deserving of money and great, of course, to lead the way in non-discrimination policies. But an undercurrent of it was that they're taking advantage of a population, a vulnerable population, and is part of the reason, I would say, argue that we have some of these disparities today. This is 2002. The people of Philip Morris are, they're being, congratulated by Out magazine as one of America's best companies. It says you can't put a dollar value on diversity, but they recognize it no matter what. They know the inherent values in a workplace that having a workplace that reflects the characteristics of the communities they serve. We see here Philip Morris being honored, by Out magazine for their support of the LGBTQ community. And so another thing that I would point out is that there's more receptivity in even more than in the LGBTQ community than in their straight heterosexual counterparts. So compared to straight women, lesbian and bisexual women were more likely to have attended an event with free samples, would be willing to wear tobacco industry merchandise. And some of that comes from, at that time, in the place where we were, in being thankful for a company that was willing to reach out and acknowledge, your community in a time when nobody else really was. So oftentimes when it comes out that tobacco companies are targeting a certain group, there's a lot of outrage, as you would imagine. But it wasn't necessarily that way in the LGBTQ community. Like I said, the editor of Genre took out a press release, to be able to celebrate receiving, funding from one of these, corporate, major companies. And even among individuals in the community, there were focus groups asking around this time, like, how do you feel about being, targeted by the tobacco companies? And it was fairly mixed or positive, feeling like, we appreciate this because it means we're not invisible. This person says tobacco ads in the LGBTQ press makes us very happy. We're not used to that, so we're very vulnerable. And so really, I know this might have seemed like a sort of a trip down, memory lane or history in a lot of ways, but I just do think it's important to remember when we're talking about smoking in a vulnerable population, like that marketing can be even more insidious and, really taking advantage of. And then there are other environmental level smoking risk factors. And so we know that a lot of tobacco treatment is offered within our healthcare settings, right? So we all, I'm sure, hope that, when you go see your primary care provider, that they're going to screen you for smoking and they're going to provide you with evidence-based, screenings and treatment. And, but it assumes that you have a primary care provider, that you access the healthcare system, and that you feel comfortable while you're there. And so this is another thing to think about, because when we think about tailoring tobacco treatment, again, for me, I like to focus on sometimes not so much tailoring the treatment itself, but working on the environmental risk factors, and then also making people feel comfortable in some of the healthcare settings that we have. And so, sorry, I'm going to try to move my little bars covering my slide. Okay. So, and this is particularly can be the case for individuals who identify as transgender on a transgender spectrum, that the smoking rates are even higher than among, lesbian, gay, bisexual individuals, but comfort levels in the healthcare system can be lower. And so this just shows that, 1 in 3 individuals who identified as transgender had delayed or avoided preventive healthcare due to having experienced provider discrimination, So obviously, if you're avoiding your preventive healthcare, you're not having as many opportunities to interact with healthcare providers, which would make it then more difficult to access evidence-based smoking cessation services. Similar, around 1 in 3 people had said they felt uncomfortable discussing their health needs with the regular doctor, their primary care doctor. So again, if you're not comfortable, if you're not accessing this service, it would certainly make it more difficult for you to receive smoking cessation services. And 51% reported being uncomfortable of people who are transgender discussing health needs with an unknown doctor. So again, 1 in 2. So this, I think, just shows us, a level of discomfort with the healthcare system that makes it, very hard to receive and deliver tobacco cessation services. But this is, of course, modifiable because a relationship with a trusted healthcare provider could facilitate tobacco treatment success. And I want to talk a little bit. So just in summary, there's obviously nothing inherent about being a person who's, LGBTQ that increases the risk of smoking, any more so than just all of these environmental risk factors and such that to really make a difference in smoking cessation. I would say the biggest thing that we could do is work to reduce some of these environmental risks. Again, sometimes it can be as simple as having GSAs in schools, as helping people feel more comfortable in their healthcare settings, and as really realizing the negative impact of industry marketing. I'll talk a little bit about subgroup differences in tobacco use characteristics. And so I'll show you this infographic from the Truth Initiative, because it not only makes the point very nicely, but maybe it's something for you to realize is there if you'd like to use this infographic in your future work. And so we know that LGBT adults are nearly twice as likely to use e-cigarettes, little cigars. Again, the question, when I was telling you, people asked me when I lived in California, like, does anybody still smoke? Who still smokes? Certainly people who are, LGBTQ and other groups, certainly people are still smoking. We've got 20% of lesbian, gay, bisexual adults, basically 1 in 3 transgender individuals. And then further among youth, it's more common among females. So LGBT female youth, so they're saying age 14 to 17 are 3 times as likely to use cigarettes and cigars as straight females, twice as likely as to use e-cigarettes in the past month. And this is just another way I just like to show those statistics. So we're at a place where 1 out of 7 adults in the US smoke cigarettes. That's very different than where we were at the original Surgeon General's report. 1 in 5 LGBT adults smoke, but 1 in 3 transgender adults smoke. And just to put that in context, 1 in 3 women smoked at the time of the original Surgeon General's report. So we've made a lot of progress in the general population, and like not so much sometimes in some other populations. Another thing to think about when it comes to subgroup differences is that obviously I don't need to tell anyone the health impacts of smoking cigarettes. Everyone's very aware. But there are some risk factors that, that are more specific. And so I just wanted to show you this infographic again, as in case, so that you know that all these infographics exist, but also as a way to show you some of these statistics. And so this is for the California Smokers Helpline, letting people know that quitting tobacco can lower the risk of complications during gender-affirming surgeries. These are materials that were created by an LGBTQ health clinic that really goes more into the link between wanting to transition and smoking. And so here, one health complication of smoking that a lot of people think about with birth control, but maybe not so much think about in terms of someone transitioning, that smoking while on estrogen therapy increases the risk of blood clots, which could lead to a stroke or a heart attack. And so this clinic, created this material. And so it says, my goal is to quit smoking. My doctor told me smoking while taking hormone replacement increases my chance of a heart attack. A gender affirming surgery is another possible motivation for someone to want to quit smoking, because We know that continuing to smoke sometimes can delay surgery if someone can be determined by their healthcare provider to be a high risk for surgery itself because of smoking. And obviously that can be a huge cause of, depression, dysphoria. But we do know that smoking complicates anesthesia, increases the chances of scarring, and it does harm the chance of surgery success. Smoking narrows blood vessels, cuts the amount of blood and oxygen reaching surgical areas, and increases chance of infection and skin tissue deaths. And so again, this infographic is pointing out 1 in 3 transgender persons smoke. And so, and that many healthcare providers are not aware of the challenges of the transgender community. So this was put out by, an LGBTQ specific clinic to sort of empower their patients to be able to talk to their providers about this. Another another harm of smoking is smoking while HIV positive. And so we know that, nearly 40% of people living with HIV smoke, but smoking can limit how well HIV medications work to fight the virus. And we also know that smoking while HIV positive is associated with a further reduction in life expectancy. And so there are groups who are, again, putting out these materials to raise awareness among the community that, again, certainly live a long and healthy life with HIV, but smoking while HIV positive can complicate things. So I'm going to move into evidence-based strategies for, sorry. Someone was at our door, and so my dog was letting me know, but we'll talk about evidence-based strategies for tobacco treatment and tobacco policy. But as I've sort of been saying and alluding to, throughout this talk, a lot of it, I think, is working to address these environmental barriers that we know are the reason that the smoking rates are so high, and also working so that to create spaces in our current healthcare settings where everyone feels comfortable coming and accessing tobacco treatment. So for anyone who works in a healthcare setting, there are really simple, small, cost-effective things that you can do to create a more welcoming space in your clinic. One recommendation for helping people feel, welcome in your clinic is to have inclusive waiting rooms in common areas. One recommendation is to put up, patient rights, and to talk about, you have the right to, for considerate, respectful treatment. You have the right to be treated, equally, to have your family respected and acknowledged. Another thing you can do in waiting rooms is put out brochures. If you have, location brochures in your space, to make sure that some of them feature people who are, LGBTQ, and also having, a statement in your statement of your non-discrimination policy to specifically call out sexual orientation and gender identity is another evidence-based practice. Another thing that you can do fairly easily is, I said fairly easily. Another thing that depending on the size of your clinic space, and you could work with your administration to ensure that your clinic space has gender neutral restrooms or bathrooms where people feel comfortable, regardless of their gender identity, is another way to signal that your space is LGBTQ friendly. Also, you can work on being able to facilitate disclosure of sexual orientation and gender identity with your forms. And this can, really go beyond clinic settings if you run programs where people are disclosing their sexual orientation and gender identity, giving people the opportunity to give you their preferred name versus, and to using that one instead of perhaps a legal name, as well as the ability to tell you their preferred gender pronouns. Also, I've seen many healthcare settings at the University of Kentucky, many providers will put a rainbow sticker on their badge or will put their preferred pronouns, just as a way to make people feel more comfortable, being able to ask people if they think of themselves, to be able to self-identify gender with multiple options, And also, as necessary, then to ask about, sex assigned on the original birth certificate. So, and also being able to disclose sexual orientation. And there's also research that shows that being out to your healthcare provider actually makes you more likely to talk with your healthcare provider about smoking cessation, which it may seem, like you may be surprised by that correlation, but it's probably a comfort level with the provider indicating that makes you more likely to be willing to do that. So these are just little things, if you run a smoking cessation program or a clinic, that can make a big difference. Then in addition to trying to make our spaces, our general spaces, more inclusive, there are also organizations that are putting out materials that are, LGBTQ specific to try to drive calls to quit lines. I did mention before, but LGBTQ people are 5 times less likely to say that they would intend to call a quit line. And so there are organizations that advertise quit lines, specifically targeting this community. This is another example of, this is the Bradbury Sullivan LGBT Community Center. They're in Pennsylvania. They're really leaders in promoting smoking cessation as part of their, community center activity, and of really understanding smoking as a leading cause of, health issues for LGBT people. And so as you can see, living proudly, living longer, and this is the number for the quit line. This is another ad that's coming out of Bradbury Sullivan, advertising the quit line: take pride, quit together. And here's one that's coming out of Maine. And so letting people know that you can get help to quit smoking and vaping, and to try to, make, to advertise that it is an inclusive service, and that hopefully this would be a helpful way to increase calls. And then finally, many of you all may have seen this, but it launched in 2016, and the evaluation finished up in 2020 of the FDA's This Free Life campaign. And so they did a campaign to try to raise awareness about the harms of smoking, but they did extensive research with LGBTQ young adults. And really, it's very strengths-based in terms of, wanting to take care of your community and take care of yourself. And so, again, it came from lots of research with LGBTQ young adults, and also people in the ads are members of the LGBTQ community. And so, this one says, every step gets us closer to a world in full color, but tobacco can get in our way. Smoking cigarettes can damage nearly every part of our bodies. Let's live in full color. Let's live tobacco-free. And these materials primarily came out digital, social media, and the evaluation, did show that they reached lots of LGBT young adults, and that the messaging was received positively. And so finally, in terms of talking about tailoring policy, I wanted to talk to you all about tobacco-free pride festivals. And so I mentioned in the beginning of the talk, when we were talking about the role of bars and the LGBTQ community, and many of you, I'm sure and hope, are very familiar with what a pride festival is, but it takes place, typically in the end of June, commemorating the Stonewall riots. And so, of course, for lots of people, these are really big events, really meaningful events for different reasons, to, just sort of be able to remember, where we've come from in our history as a community, but also to celebrate the progress and to celebrate love and family. And so these events are, take place now really all over the country, here in Kentucky, even in Kentucky, which maybe if you're in Maryland, you're thinking, that Kentucky, being as rural as we are, may not have that many, but even we have some tiny cities that have, pride festivals now, which is wonderful. And also, there are a long time, the LGBT community has, recognized certain issues as disproportionately, impacting us. So it's very common at something like a Pride Festival to have health departments coming and doing HIV screenings and stuff like that. But it has been less common to see things like smoking cessation, even though we know that smoking is the leading cause of preventable death and disease. That's for LGBTQ people. Even if you are, HIV positive, unfortunately, smoking will further, reduce your lifespan. So, but it's, coming around the realization of smoking specifically as an LGBTQ issue. And therefore, because of the significance of Pride in the community, it can be helpful to have tobacco-free Pride Festival events. And so I'm going to show you parts of a tobacco-free Pride toolkit that we developed here in Kentucky, because we did, I am affiliated with the Kentucky Center for Smoke-Free Policy, and we were receiving, requests for technical assistance for, how to do this. And so we put this together. And so I'm showing you now, snapshots from this toolkit, but I'm happy to, if anybody would like to see it, to send you the full thing. But the creation of our toolkit, we created it with input from our community. And so that means that we actually interviewed 12 LGBTQ advocates who had successfully implemented tobacco-free Pride festivals from across the nation. We also had solicited quotes and photos from individuals who attended Kentucky Pride events so that we could include those and have this local, local individuals featured. And then we interviewed some local LGBTQ leaders and also did a Q&A with them on the importance. And this toolkit also incorporates took the community feedback and incorporated it with existing evidence-based tools for policy implementation. So we use the 3 T's model for adopting tobacco-free college campus policies. We did work with the California LGBT Tobacco Education Partnership's 2006 Smoke-Free Pride Toolkit. We received their permission to try to take some of what they had used, but be able to tailor it for Kentucky, and also updated some to more of a tobacco-free context, including e-cigarettes, things like that. And we also used scripting from UK's Tobacco-Free Take Action website. So I'm just going to show you a few snapshots of it in case, but like I said, if you'd like to see it, or if you'd like to create something similar for Maryland, maybe it would be helpful. But again, these are local individuals, so it would be recognizable to a lot of us in the Kentucky, LGBT community, and of course received photo releases. So quotes like "smoke-free Pride events create a safe and healthy environment for everyone," or the idea that everyone has the right to breathe clean air and enjoy the Pride event is why this particular advocate was interested. When there's tobacco and secondhand smoke, it creates a barrier for people with HIV, heart disease, lung disease, and people who bring their children. We also talked to these advocates about specific barriers to tobacco-free prides. Well, we also in the toolkit would help people understand that typically a Pride event would be smoke-free based on a decision of the Pride board, unless it was taking place in a community space or park or something that already had a tobacco-free policy. So we gathered these tips from advocates to ask, what barriers did you face, and what would you recommend for someone else interested in this area? And so one of the big things that everyone said is that there's going to be a financial concern. And so these are just some quotes that we had. Understand that these are almost all volunteer-run festivals. They're very reliant on ticket sales. If they make this big change and then lose ticket revenue, then they can't continue their festival. And this was from a national advocate, but I know from experience in Kentucky that at least the Pride Festival here in Lexington, the revenue actually generates a lot of the operating costs of our Pride Center for an entire year. So it's a very real concern that to lose money would be very devastating. And this individual said, we don't really need to persuade them, the Pride Board, as much as we need to demonstrate it won't harm the festival. They all want it to be smoke-free if they can make it happen. They're concerned that they can't. And that's where we, tobacco control advocates, can come in and say, well, we can work with you and make it happen. And so here are just some of the considerations. They suggest distributing a petition at LGBTQ events about support for a tobacco-free pride, asking local LGBTQ owned or friendly businesses to sign a letter of support, or highlighting the successful tobacco-free pride festivals in other communities, which there have been many, and they did not suffer this devastating financial loss that there's a fear of. This is another example of a tool that we put in our toolkit. Like I said, it's modified based on the 3Ts model that was created for tobacco-free policies on college campuses. And so the T stands for tell, clearly communicate with all key stakeholders, spread the word before the event. We talk about creating a thorough, multi-pronged plan to advertise the policy during the event in terms of signage, mentioning it from the stage, distributing maps that show the boundaries of the Pride Festival itself. If possible, we recommend providing tobacco in the event, particularly if you can partner with a university or health department in your area. We know a lot of pride, committees may not have the funding to do this, but they may be able to partner with these other organizations. And then another big thing would be just training your volunteers or event staff about the policy, including like how to respond to policy violations, because this is a big fear that people have, that, how will we respond? And we don't want to have an adversarial environment during Pride related to smoking. Of course, we understand that, and nobody would want that. So we have some information in here about scripting and helping people feel comfortable. So just showing you, so here we have some quotes that go into the tell part, raising awareness about the Pride. So this person said, at the event, we produce signage that is throughout the entire festival. It says, welcome to Smoke-Free Pride. And then their team is out in force putting LGBT smoke-free stickers on people. They said they typically can give 3,000 to 5,000 away. This person said, I got the Pride board to pledge to go smoke free and also to allow me to provide signage. We had signs in the front, signs as people were coming in, signs at the beer booth, porta potties, there's signage everywhere. And for the most part, it was respected. And we know that to be true with a lot of smoke-free policies, that the vast majority of people simply respect the policy and there's not a great deal of enforcement needed. We do talk about treat, which is the second T. So as is possible, we know some of these festivals are very small. Consider providing on-site tobacco treatment or facilitated referrals to the quit line or just the quit line information. But I did find this particularly fascinating, that this particular advocate was saying that they do referrals, like facilitated referrals to the quit line. So they set up a booth, even just that, having people fill out this form that they want to be connected to the quit line. They said that they get more quit line referrals during that day than any other time during the year. So you can do a lot just with referrals if you can't provide on-site service. And then train. And this, like I said, was the thing that came up the most in our interviews, and the concerns that we hear about why somebody may not want to go tobacco free, in terms of, well, what could we say? What do we do? How do we approach someone? And, quite honestly, it's mostly self-enforcing. And again, nobody expects that you're going to go out and be issuing citations or anything like that, but rather just letting people know about the policy. But we did modify a script that the University of Kentucky uses for our college campus policy. And so, you see it just simply, my name is this, I'm a volunteer with the Pride Festival for the health of our community. Our Pride Festival grounds are tobacco free, and we ask that you respect our policy. Put your cigarette out. You can also let people know, again, if you have a map with the boundaries of the festival, really just where they can go to smoke. And so then finally, these in our, I mentioned that we created this toolkit and we pulled together these tips from national and local national tobacco-free advocates who had worked on these policies. We also were able to obtain pictures for the toolkit and also quotes from, like I said, members of our local communities here, so you can see this. But we also received funding for our work in tobacco-free Pride from the Kentucky Department of for Public Health, and we got expert consultation provided by the Kentucky Center for Smoke-Free Policy, where they again have a lot of expertise in tobacco-free college campus policies, and the Americans for Non-Smokers' Rights were very instrumental in helping us. And I would just end on this one case study where in Lexington, we actually the chair of the Pride Board reached out to us and said that they wanted to go tobacco free. And not only did they want to go tobacco free, but they wanted to not allow tobacco vendors to include e-cigarettes, which was would be very progressive here, because there are, at least here, lots of, electronic cigarette vendors, and there was no advocacy for that. That came just as a request to us. And so we were able to reach out to the Americans for Non-Smokers' Rights, and in doing so, asking them at this time, before we had this toolkit, is there a policy? Like, is there a model policy? And we learned that they could take advantage of a rapid response grant, because in some tobacco growing states, because we are, so behind in some other types of smoke-free policy, they were able to offer money, a small implementation grant to the Lexington Pride Festival to be able to create signage, and we're able to provide technical assistance. The only downside of the story is that Pride was canceled due to COVID ultimately, but still, it was excellent and helpful to see, how that there really are resources for this kind of thing, and also that you really don't need a lot. So that $5,000-$10,000, implementation grant would go a really long way to getting all that you would need for signage, checking out ads in the newspaper, and yes, so there's a lot of support and help and assistance if this is a direction that you want to go. And if you'd like to see this toolkit or I can answer questions right now, but you can also email me questions, and here is my contact information.
Great, thank you so much, Dr. Fallin Bennett. So again,
before you go to questions, let me just jump in quickly, Ashley, and just say thank you very much. We're giving you virtual applause that you probably can't hear because everyone's muted, but that was wonderful, and just thank you, and we'll now move to questions.
Carlo, did you want to ask your question since you had one that you threw in the chat?
I did have you talk a lot about the smoking, but I wondered about the vaping and whether there was anything in the approaches that was different between smoking and vaping.
So we do know that, the vaping is also, higher in LGBTQ individuals. And I believe among youth, it's twice as high, but here in Kentucky, there are lots of vaping. So it's certainly, just an issue, youth in general, here in Kentucky. But certainly one of the things that we did when we updated the existing, which it was great, the California smoke-free Pride toolkit was to be able to add things in to specify that we do mean tobacco-free, and how do you define tobacco-free to include vaping. And also a big thing here are the vendors at Pride events. And so a lot of e-cigarette vendors come. And so talking with people about who are interested in prohibiting the vendors to, of course, remember to include the vape shops and things like that. And so yes, that was a big part of the original reason for updating the toolkit, was to take it from a smoke to a tobacco-free focus.
Mm-hmm. And so the vendors actually do have some presence at the Pride events?
Certainly here, yes, especially in the cities large enough to have vendors. So, in Lexington, some of our prides in Kentucky are like picnics, but the big Pride festivals, in Lexington and Louisville, that bring in 30, 40,000 people, absolutely, yes, there's lots of vendors, and 3, 4, 5, vape shops would be typically set up as a vendor. So like I said, when Lexington reached out and not only wanted to go tobacco free, but wanted on their own, which I feel like a lot of times when people ask us about what would be the evidence-based policy, we mention what about vendors, and they hadn't thought of it, but they told us, we want to include vendors.
Great, thank you.
So we do have a couple more questions coming in. One of which is if you know if researchers have found that tobacco use is lower among LGBTQ youth in more LGBTQ friendly states compared to states that do not have as welcoming legislation.
Yeah, there have been, I don't know about youth, and I'd have to go and look, but there have been some studies showing that LGBTQ friendly policies are associated with lower rates of smoking.
Great, thank you. One other question we got was, and this might be something that we might need to phone a friend for our afternoon session with Natasha Phelps, but wondering if you know if the King family and or the MLK Center endorsed green smoke. I don't know if you're familiar with those topics.
Oh, I think it's because of that ad. I don't know, because I shouldn't say, but I guess I would say I sort of doubt it. It seems like they just took a screen, it was a screen grab with the, greens, but I can certainly be wrong, but I don't get that impression. I think that it seems to me as though they were just co-opting the image, but I don't know.
Okay, great. Yeah. And again, Virgil, I think, was who asked that question. We might be able to ask that again in our afternoon session. But so far, I don't really see any other questions, just honestly, a lot of thank yous and positive feedback from your presentation. And, one person even said that they were getting ready to retire and your presentation inspired her to become active in rights for this community. So hopefully that's a nice little extra little positive note to end on, unless anyone has any last minute questions to throw in the chat.
I wanted to just check with you because I'm really struck by the fact that your talk a lot of kind of, so I said, okay, let's talk about how to adapt our smoking cessation and tobacco cessation efforts to this community. But you focused a lot more on kind of making our tobacco efforts a lot more accessible, having more of a sense of connection with this community, that's really how you adapt it. You don't need special techniques, I guess, is what I'm trying to think. I wondered what you thought about that, and I think that's been the push for your talk, but I just wanted to confirm that.
Yes, and in some ways, maybe it's a really big ask, because in some ways, maybe I'm saying we just need to change the world so that, and promote, LGBTQ rights and equality, and the smoking will just come along with it. But truly, what a lot of research indicates is that people who are LGBTQ want to stop smoking, as much as anybody else, and have just the same, interest and success with our evidence-based practices. It's just that so many barriers that might stop somebody from feeling comfortable reaching out. So yeah, definitely, I think more than reinvent the wheel is just look at what you're already doing and how you can make it more accessible.
Great, thank you.
We do still have a few more minutes for questions, if anyone would like to share those in the chat.
Like I said before, it's very nice to come to Maryland from my house today, and I am definitely sorry about the dog barking. Somebody must have been walking outside, but it was very nice to see you all. And if anyone has questions after the fact, you can always reach out to me.
Well, thank you, Amanda. We appreciated having your support system in the process as well, kind of cheering you on as you kind of did your talk. That's between cats and dogs. We have a lot of those in all of our Zoom and WebEx meetings these days, so they're more than welcome. And I want to thank you again, and thank you for the wonderful talk and the resources that you have kind of shared with us, because I do think that's really helpful. That is a target of um, our outreach to the disparate communities, like you're saying, who have a lot of disparity in terms of health access, but also in terms of smoking cessation. So we're hoping that this will stir in our state a lot more activities that are focused. We had Dr. Scout here a couple of years ago talking some about that, and I think it's really important to kind of just re-energize our efforts with this community. So thank you for giving us that and giving us the support to do that. Appreciate it.